Most people don't know that the kidneys can lose up to 90% of their function before symptoms appear. By the time you feel something, damage may already be happening. This video shows 12 early signs of kidney damage, all backed by science. You'll find the clinical studies linked in the description. Some signs may look normal: tiredness, swelling, foamy urine, but they can mean your kidneys are struggling. Notice them early and act now, before it's too late. Disclaimer: this video is for educational purposes only and not a medical advice. Always consult your healthcare provider. All research references are listed in the description. Sign number 1: changes in urination. When your kidneys start to weaken, one of the first things you'll notice is a change in urination. You may go more often, especially at night, or sometimes barely at all. That happens because the kidneys are not balancing fluids properly. If the filters are damaged, you'll either lose too much fluid or retain too much. This is why urine output suddenly increases or drops sharply. It's a simple but powerful clue that something is wrong with kidney function. If these changes persist, it's time to get tested. Sign number 2: pain or burning when urinating. Pain or a burning feeling when you urinate is a warning sign that something is irritating your urinary tract. It often begins with a bladder infection, but if ignored, it can travel up and affect the kidneys. When bacteria or stones block the urinary flow, they cause inflammation and swelling, which makes urination painful. Sometimes the urine may contain tiny sand-like particles. These are small kidney stones or mineral crystals forming inside the kidneys. This is the body's way of telling you the kidneys are under stress. If burning, pain, or gritty urine continues, get a urinalysis and kidney function test right away. Early treatment can prevent more serious damage. Sign number 3: blood in the urine. Seeing blood in your urine, even a faint pink or tea-colored tint, is never normal. It means there's bleeding somewhere in your urinary system. This can happen when kidney stones scratch the inner lining or when infection or inflammation irritates the kidneys. Sometimes the bleeding is microscopic. You won't see it, but a urine test will. Blood in the urine is one of the clearest signs that the kidney filters are damaged or inflamed. Ignoring it can lead to infection, blockage, or permanent scarring. If this happens more than once, get checked immediately. A simple urine analysis and ultrasound can confirm the cause before it becomes serious. Sign number 4: foamy or bubbly urine. It's normal for urine to form a few bubbles when you urinate with force or after holding it. But if the foam doesn't go away after about 2 minutes, it can be a sign that protein is leaking into your urine. Healthy kidneys keep protein in the bloodstream. When the filters, called glomeruli, get damaged, protein slips through and mixes with urine, creating persistent foam. This type of foam doesn't come from air. It's caused by protein reacting with the surface tension of urine. If this happens often, it may be an early sign of kidney damage. A urine protein test can confirm it before the problem gets worse. Sign number 5: swelling of the feet, hands, or face. When the kidneys start to weaken, they can't remove excess salt and water efficiently. As a result, fluid begins to build up in the tissues. This causes swelling, often around the ankles, feet, hands, or under the eyes. It may be mild at first. Your rings or shoes feel tighter, or your face looks puffy in the morning. This happens because the kidneys are not balancing sodium and fluid properly, allowing water to collect under the skin. Doctors call this condition edema. If swelling keeps coming back or gets worse, it's a sign the kidneys may be losing their filtering power. A simple urine and blood test can help confirm if fluid retention is kidney-related. Sign number 6, unusual tiredness or weakness. Feeling tired, weak, or dizzy for no clear reason can be an early sign of kidney problems. When the kidneys slow down, toxins start to build up in the blood, making the body feel heavy and drained. The kidneys also help create blood. They release a hormone called erythropoietin, or EPO, which tells the bone marrow to make red blood cells. When the kidneys stop releasing enough of this hormone, the body produces less blood, leading to anemia. When you're anemic, there isn't enough oxygen reaching your cells, so you feel tired, lightheaded, and unusually cold, even in a warm room. That constant chill is another clue your kidneys may not be doing their job properly. If these symptoms persist, a blood test for hemoglobin and kidney function can confirm whether the kidneys are involved. If you like what you're watching so far, please subscribe for more science-based health videos that help you understand your body and protect it naturally. Sign number 7, pain in the lower back or side. A dull ache or sharp pain in the lower back or side can be a warning that something is wrong with the kidneys. This pain often appears just below the ribs, on one or both sides. It can happen when kidney stones block the urinary tract or when an infection causes inflammation and swelling. Sometimes the pain comes in waves, especially if tiny stones or sand-like particles are moving through the ureter. Because the kidneys sit deep in the back, this discomfort is often mistaken for muscle pain. But unlike muscle pain, it doesn't improve with stretching, massage, or rest. If the pain is persistent or severe, it's time for a urinalysis or kidney ultrasound to find the exact cause before it worsens. Sign number 8, trouble sleeping or restless legs. Having trouble sleeping or feeling restless at night can be a sign that waste is building up in your blood. When the kidneys can't filter toxins properly, those toxins affect the nerves and muscles, making it harder to relax. Many people with kidney issues experience restless legs, muscle cramps, or difficulty staying asleep. This happens because imbalanced minerals, like calcium, magnesium, and potassium, disrupt normal nerve signals. The result is poor sleep quality and fatigue the next day, which only adds more stress to the body. If sleep problems or restless legs happen often, it's worth checking kidney function. Toxins and mineral imbalance may be the real reason. Sign number 9, nausea or loss of appetite. When the kidneys can't filter waste properly, toxins build up in the blood. This buildup affects the digestive system, making you feel nauseous, bloated, or uninterested in food. Food may start to taste metallic or bitter, and even favorite meals might cause discomfort. This happens because excess urea and waste chemicals in the bloodstream interfere with taste and digestion. Over time, this can lead to weight loss, muscle wasting, and nutrient deficiency. If nausea or loss of appetite happens frequently, especially with fatigue or swelling, it's time to check kidney function and blood urea levels. Sign number 10, high blood pressure. High blood pressure is both a cause and a result of kidney damage. The kidneys help control blood pressure by managing fluid balance and sodium levels. When kidney function drops, excess salt and water stay in the body, causing blood volume and pressure to rise. At the same time, damaged kidneys release more of a hormone called renin, which further raises blood pressure. This creates a dangerous cycle. High blood pressure damages the kidneys, and weak kidneys push blood pressure even higher. If your blood pressure stays high despite medication or lifestyle changes, get your kidneys checked. It may not be a heart problem. It could be a kidney problem. Sign number 11, shortness of breath. Feeling short of breath, even without exercise, can be linked to kidney problems. When the kidneys can't remove excess fluid, that fluid can build up in the lungs, making it harder to breathe. Another reason is anemia. When the kidneys stop producing enough erythropoietin, the body makes fewer red blood cells. With less oxygen in the blood, even small movements can leave you winded or lightheaded. This combination of fluid overload and low oxygen is common in kidney disease. If you feel short of breath often, especially when lying down, get checked for fluid retention or anemia. It could be more than just fatigue. Sign number 12, dry or itchy skin. Dry, itchy, or flaky skin can be a sign of kidney stress. When the kidneys aren't filtering waste properly, toxins build up in the blood and begin to irritate the skin. The kidneys also help balance minerals like calcium and phosphorus. When these minerals rise in the bloodstream, they trigger itching, dryness, or a grayish tone in the skin. This isn't a surface problem. It's a signal that the blood chemistry is off because the kidneys aren't keeping minerals in balance. If the itching doesn't go away or gets worse at night, it's time to check kidney function and mineral levels. If you've noticed these signs, the first step is to get checked. Start with a urinalysis to see if there's blood, protein, or infection. Follow that with a blood test that includes creatinine, BUN, and eGFR to measure kidney function. If pain, swelling, or foamy urine continues, ask for a kidney ultrasound to look for stones or blockages. Also, have your blood pressure evaluated. It's often the earliest clue something's wrong. These simple tests can detect kidney stress long before symptoms become severe. Once you have your results, your doctor can confirm the cause and guide the next steps. Once kidney stress is confirmed, the goal is to treat the cause and protect what's still working. If the problem is high blood pressure or diabetes, keeping those under control is the top priority. These are the two biggest kidney stressors. Doctors may adjust or stop medications that strain the kidneys and treat any infection immediately to prevent scarring. When tests show anemia, protein loss, or swelling, specific treatments like iron support, ACE inhibitors, or diuretics may be prescribed to stabilize function. Lifestyle changes matter just as much. Focus on fresh, whole foods, low in sodium and sugar. Stay hydrated but not overhydrated, and avoid processed foods, alcohol, and smoking, which make the kidneys work harder. Include gentle exercise and enough sleep to help circulation and recovery. With early detection and consistent care, kidney damage can often be slowed or even reversed. The key is to act early, follow your doctor's plan, and support your body every day through smart choices. Kidney problems don't start overnight. They build slowly, one small symptom at a time, until it's too late to reverse the damage. But if you've made it this far, you already have the most powerful advantage: awareness. You now know what to watch for, what tests to ask for, and how to take action before things get worse. Protect your kidneys now through early testing, healthy habits, and the right medical guidance. Once kidney function is gone, it doesn't come back, so every step you take today truly matters. If you found this video helpful, please subscribe and share it with someone who needs to hear this. As always, stay curious, stay smart, and most of all, stay healthy.